Hi, good afternoon. This is Elizabeth Hardig with the American Planning Association. Welcome to Session 5 of our Planners for Health webinar series. Today we will be discussing communications, framing, messaging, and marketing. It's wonderful to have you all back in the webinar space. I know we took a bit of a hiatus last month and had a face-to-face meeting with our Planners for Health grantees. So it's great to see you all again, or at least see your names. As a quick reminder, we are recording the session this afternoon. You will receive a copy of the webinar recording via email after the session tomorrow or Friday. And of course, you're always welcome to check out the recording on APA's YouTube channel too. We have 60 minutes of wonderful action-packed content for you to enjoy, and then at 4 p.m. Eastern Standard Time, we will shift to an optional discussion. So we hope you'll stay on the line to continue to talk with the panelists and of course our co-host this afternoon, Prevention Institute. You should see a chat box on the right-hand side of your screen. Feel free to chat questions throughout the webinar, throughout the session, and we will discuss them at 4 o'clock. All right, so these I'm sure are familiar faces and familiar names. Our colleagues from Prevention Institute have been stewarding us through this process and really stewarding the curriculum development. Rachel Bennett and Sandra Vieira from PI. As a quick reminder, if you've forgotten, Prevention Institute really brings together cutting-edge research, practice, and analysis to today's pressing health and safety concerns. PI is building a movement to transform communities to support equity, health, and safety in the first place by bolstering the conditions and factors that foster resilience and well-being, which of course is what Plan for Health and Planners for Health is all about, so we're grateful to have PI's expertise as part of this experience. Rachel Bennett is the Associate Program Manager at PI and works collaboratively with partners on research, policy advocacy, and technical assistance related to healthy, equitable community development and health in all policies. Rachel earned dual master's degrees in public health and urban and regional planning from the University of California, Los Angeles. And as a quick reminder, Sandra Vieira is also from PI, a program manager and a graduate of the University of San Francisco with a master's in public administration and policy. Sandra joined PI in 2010 and works to promote safe and healthy communities through projects focused on improving the built environment, increasing equitable opportunities for physical activity and play, and of course, increasing capacity, which is what they're all about and why they're here today. So I'm going to go ahead and throw over to you, Rachel and Sandra, to kick off our webinar.
Thank you, Elizabeth. Good afternoon, everyone. This is Rachel Bennett.
And Sandra Vieira.
And it is so nice to be back with you all today. It was really wonderful to meet and see so many of you in New York last month at APA's National Planning Conference. And welcome to those who haven't joined us for one of the Planners for Health webinars before, and welcome back to some folks who have. Today we're going to be talking about communications and framing, and I think it's a really interesting moment to have this conversation because these were issues that emerged at the New York session as really prominent across all the Planners for Health projects. Some of the things we talked about, just to quickly recap for those who weren't at that session, so we talked about strategies around reaching out to potential partners and funders. Communications plays a big part in that, obviously. Challenges and opportunities around engaging community residents and youth and other stakeholders. We talked about building credibility and demonstrating return on investment, particularly with elected officials. And one of our guest speakers today will talk a lot about strategies around framing to garner that kind of public attention and to underscore how important healthy planning work is. We also talked about how to strengthen collaboration within our existing coalitions and networks. And finally, building momentum for norms change in our field, both in terms of raising public awareness, but also changing the way we approach our work so that planning for health is how planning and how public health work is done in the first place. So communications touches on all these topics, and in fact, even though we have arranged the 6 sessions across the year, communications is really part and parcel of every single topic. one thing we want to talk about today is harnessing the power of communications and framing, not just to tell people about our work, but really to show them how they can be a part of the work, show them the value of the work, show them how we can create this paradigm shift within the work that we do. And as I said before, communications, that it's a really critical part. It's part of assessing the landscape in the work that we're doing. It's part of collecting and disseminating data and of developing effective strategies. So we're very excited to be talking about communications and framing today. I just want to cue up for people that our final session, I'm not sure, it looks like maybe the slide is a little bit cut off, but at the bottom of the screen it says that our final webinar will be on sustainability and sustaining healthy planning initiatives. Communications and framing is really a key part of that too, in terms of building those effective coalitions and networks that can sustain beyond any one funding opportunity and diversifying funding. And again, building and sustaining visibility with the public, with decision makers, with the media, and with partners in the field.
Thanks, Rachel. And with that, and by popular demand, and I think strategic demand, we are going to do a deep dive on communications and framing, because we know that achieving health equity requires engaging so many different community stakeholders and changing practices across a number of systems. So we need to think about how to effectively communicate and engage with different audiences who influence or who can be very critical in our work. So in thinking about really who would be best to speak to us about that, I think today's lineup of speakers really gives you, the who's who and the best of the best out here. We are very delighted to be joined today by Berkeley Media Studies Group. As a longtime partner of Prevention Institute, their approach has been influential in how we as an organization and as advocates for prevention and health equity do what we do. In fact, an understanding that the challenges communities face today are rooted in structural inequities and imbalance of power and resources, stemming in the past but occurring in present day. We really point to comprehensive community-led solutions that include systems change to address issues. Now, that's been very important for us as an organization to remain committed to that complexity and to a language that reflects that comprehensive nature of what we're doing. But we also, had a learning opportunity through the work of BMSG and other groups to recognize that messaging that complexity needs to be done in a way that really engages different stakeholders, including policymakers and media, community leaders, and non-health groups. So we need a concise, straightforward, and easy to grasp approach. So what you see sort of before you is some of that support and that strategy that BMSG has helped Prevention Institute with, which is sort of communicating community prevention as something that saves lives and money, that makes economic sense, that emphasizes local solutions and community-led solutions, emphasizes a value of collaboration and partnership, and addresses multiple community priorities. So they were really instrumental in helping us stay with the big picture, but really think about kind of concrete, concise, and straightforward messages for the work that we're doing. So Berkeley Media Studies Group, or BMSG, has supported PI as well as countless other organizations, agencies, initiatives, and leaders in our field. So we're thrilled to showcase them on today's webinar. So let's get to it by introducing our speaker from BMSG, Fernando Quintero, who is a strategic communication specialist at Berkeley Media Studies Group, where he provides media advocacy training and strategic consultation services. Prior to joining BMSG, he worked as a print journalist for several newspapers and served as a managing editor of Latino.com. Fernando has covered a variety of beats, including health, immigration, and demographics. He served as a communication strategist for the University of California, as well as several nonprofit organizations and private enterprises. He's a former director of Newswatch Project, a media watchdog organization that promoted fair and accurate media coverage of the LGBT community and communities of color. He received his BA in journalism and public relations from Cal State Fresno and is a proud alumnus of the Institute for Journalism Education at UC Berkeley. So we're so excited to have Fernando here. And with that, Fernando, I'm going to let you take the reins and control and pass things over to you. Welcome.
Thank you so much for that introduction. I'm thrilled to be here with you all today. I've got a lot of material to cover in a fairly short amount of time, so let's get started. As was mentioned, we're going to take a little deeper dive into communication strategy. But very quickly, I want to just mention 3 areas of focus for BMSG, just to get a better idea of what we do and our role in improving advocates' ability and capacity to push for policy change. So one of the main functions of BMSG is to do research on news coverage of public health issues so that we better understand what the conversation is and really the starting point for changing, making those paradigm shifts, changing the narrative, and reframing the conversation. And then we also do what mostly my role here at BMSG is, which is media advocacy training and strategic consultation. And then last, and that's something that we've been ramping up more recently, is working with journalists so that we can also help affect change in the industry and in newsrooms across the country so that journalists can better understand and include the environment in their stories and also include solutions as well instead of just presenting really the problem. So today's presentation, we're going to talk about the role of communications in shaping debates around community health. We're going to explore some key basics around media advocacy, including strategy and framing. And then we're also going to review some key communication strategies around messaging. So that will include the importance of including values and delivering messages that support your health equity goals. So the opening question for you all is, will better community health come about primarily as a result of individuals getting more knowledge about their personal health behaviors, which is what a lot of us have been engaged in the past? Or is it about groups getting more power to change social and economic conditions? And of course the answer to that is both. Of course we want individuals to make good choices about health behaviors in terms of what they eat and healthy beverages and not smoking and getting exercise and all of that we know is important to good health. But also we must give groups, especially groups that have historically been underrepresented or misrepresented and haven't had the power to take control of their communities in terms of health. What we really want to do is change that paradigm so that they can be involved in the policymaking process. They know their neighborhoods best, and they know what sorts of changes need to happen in order to be healthier. So I want to break down real quickly what we do here at BMSG, or what we focus on rather, which is media advocacy. And some of you may not be familiar with that concept, so I'll quickly break it down for you. Media advocacy is about strategy. It's about the strategic use of communications to support community organizing to advance a social or public policy initiative. So most folks in public health are more familiar with what we call social marketing. But before I get to sort of the difference between media advocacy and social marketing, I want to remind everyone about the role of the news media and the role of communications, especially given the modern environment where communications have really become a lot more democratic in terms of community journalism, more involvement in responding to stories on online news sites, bloggers, And of course, social media has also been a major influence in how we receive our news and other communication. So a reminder to everyone that the news media, and of course, when I say news media, I am including this more expansive definition of the news media, still plays an important role, and we need to keep that in mind. We need to understand that the news media still sets the agenda in terms of what it is that we're thinking about. It shapes the debate, so not only what we think about, but also how we think about a certain issue is shaped by the news media. And then, of course, it reaches opinion leaders and decision makers. So what we do about an issue is largely shaped by the news media. So a reminder to everyone that the news media plays an important role, and it's also a call to action for all of you to re-engage with the news media if you have disengaged, like so many of us do, because for obvious reasons, a lot of the media that we hear, see, and read is bad news. It's depressing. There's controversy around what's actual news. There's a lot of fluff news. So a lot of us have disengaged from news media coverage. But it's important for us to re-engage so that we understand what the conversation starting point is around issues that we care about. And the news media gives us that sort of temperature taking of how the public views issues that we're working on and care about. So quick communications comparison. As I said, most of us have been involved in what we call social marketing. So you see the two examples above, social marketing and media advocacy. The first one is a ad that many of you, I'm sure, have seen about eat your 5 fruits and vegetables a day. So that's about an individual focus. It's about warning and informing the general public. It's about asking for a behavioral change or personal change. It's about providing a message that audiences can act on if they choose. And it's about filling the information gap. If only we had more information about nutrition, physical activity, and other ways to keep us healthy, then the assumption is we'll be healthy. And in fact, we need to keep in mind the goals of media advocacy, which is not so much focusing on individuals, but focusing on an issue, focusing on a health issue that we want to see improved in our community. It's not so much about warning and informing, but rather pressuring decision makers and mobilizing communities to push for change. Rather than personal change, it's about making a policy change. Rather than a message to act on, it's about giving voice to communities that, especially those communities that, as I said earlier, have been disenfranchised and left out of the process. And then last, it's not so much about filling the information gap, but rather the power gap, so that communities can be empowered to be a part of the process. So moving on, let's move on to the importance of strategy and the importance of message strategy. And the most important lesson when we're talking about how to be strategic in our messages, whether they're to strategic partners and funders, or whether it's engaging youth and other stakeholders, or whether we're talking to elected officials. The same applies all across. If you don't know what to say, it's likely because you don't know what to do. So it's very important for us to be all on the same page and understand what our ultimate goal is. And so this is what we call at BMSG our layers of strategy. And on our website, and I can also follow up and send you all this important document that we use as a guide for media advocacy and strategic communications. But basically the 4 layers are having an overall strategy so that everyone is on the same page, Then we can think about media strategy. What type of media? Are we talking about reaching influential bloggers? Are we talking about a Facebook or Twitter campaign? Are we talking about reaching out to traditional media? Are we talking about even engaging the media at all when a one-on-one conversation with decision maker or decision makers will do? Then we can start talking about what our message should be. And then last, how to access whether the media or social media or whichever vehicle we're going to use to get our message out. So again, strategy and thinking through strategy is really important before we even start thinking about what words we want to say. So going to the very first layer of our layers of strategy is the overall strategy. And these are key questions that we want to ask ourselves so that we're all on the same page. What is the problem or issue we want to address? And we want to define that as narrowly as possible so that our solution, whether it's a policy solution or a wellness policy or whatever it is that we're choosing as a solution, will match the problem or issue we're trying to address. Second, what is the solution or policy? As I just mentioned, we want those to match. We need to identify who we're targeting our message to. So oftentimes we will want to target the decision makers or those who have the power to make the change. If part of our overall strategy is engaging the community and other stakeholders, then obviously we want our message to also be inclusive of them or directly targeted at them. So that's all part of the decisions and the discussion that you have at the outset. And then last, who is it that we must mobilize to apply the necessary pressure to make the change that we want to seek? And what do our targets want to hear or need to hear from us? Again, whether that's the decision makers or the partners and stakeholders that we want to engage. So now I'm going to talk a little bit about framing. And we can have just one person type in, because I'm sure you're all going to agree with what it says behind the yellow bar. So I'm going to take 10 seconds, and if somebody can just type that in for us, that would be great.
Elizabeth, are you getting any responses on the chat box?
I do have a few folks typing and seeing prevention works as a possible solution.
Yep, prevention works. I think is probably going to be the consensus among participants. And voila, that's what it actually says. So this little exercise is to illustrate the point of framing. As we just saw, we filled in the blanks with the information that was given to us. That's a fairly simple way of explaining the idea of framing. Our audiences automatically fill in the blanks with their own information, their own point of view, based on their own experiences, their own life experiences, the communities they come from, so on and so forth. And that's really important to understand, because when we're trying to be effective, strategic messengers, we need to understand the point of reference for our audiences. If we don't understand that, then we cannot be strategic messengers. So a quick explanation of framing is that they're mental structures, basically, that help people understand the world around them. And like the frame of a house, it really supports an entire belief system that we all have. So it's a very solid, entrenched process that we all bring to the table, or not process, but rather point of view that we all bring to the table. And so that framing that we automatically sort of have is really rooted in an idea of individual responsibility. That is a dominant frame, one of many frames that exist. But the one that we care about when we're being strategic messengers is the frame of individual responsibility that not only dominates and is a narrative of our culture, it's reinforced by the news media, and it's reinforced by our own belief system of everyone being able to pull themselves up by their bootstraps. So we need to reframe that narrative and change that narrative, and I'm going to give you some ideas on how to do that. But first, I want to quickly explain what's on the slate in terms of this default frame of individual responsibility and the frame that we want to move to, which is really more of an equity and social justice frame. So the dominant frame of personal responsibility brings into view such ideas as you're on your own, you have a duty to your family, and in many parts of the country there is still a strong belief and a strong feeling that the government and therefore policies are more of an interference. Many of you have heard the term nanny state, and that's something that in many parts of the country you have to deal with. And where we want to move folks is from personal responsibility to shared responsibility. Instead of you're on your own, we're in this together. Instead of duty to your family, it's to the collective good. And instead of interference, we want to show that in fact this policy is to protect us all, and that public health has a long history of making changes that have helped folks at a population level. Here is an example of how those competing stories play out with the issue of diabetes and other nutrition-related disease. Notice that I don't have obesity as the issue here, because that word alone tends to conjure up a frame of individual responsibility. So here is an example of those two frames. So when we're talking about nutrition-related diseases, the dominant frame or default frame is people are making bad personal choices. They may have absent parents. They may have poor role models. They may have a lack of willpower. And the way that we reframe that conversation is what surrounds us shapes us. So if we want to talk about bad personal choices, what we really should be talking about is food deserts or the lack of healthy options in a lot of our neighborhoods. Instead of absent parents, we can talk about predatory marketing, which goes on by the junk food and soda industries on a daily basis, particularly targeting communities and youth of color. If we're talking about poor role models, we can talk about celebrity endorsements of soda and junk food. And these aren't just celebrities, but cultural heroes and influential people that have a big impact on young people's decisions. And instead of lack of willpower, we should be reframing the conversation to talk about lack of access to healthy food and safe places to exercise. So obviously, things are out of balance in terms of that frame, and we need to start tipping the scales so that we can include both personal responsibility and institutional accountability. We've seen from tobacco the cultural shift, really, of talking about going from talking about smoking and smokers to talking about tobacco use and the tobacco industry. So that is a continuum that we want to see with other issues. So what can we do to change the frame, change the conversation? Again, we need to understand how the issue that we're dealing with is currently framed, both what the default frame might be among our audiences and how the media and social media conversations are framing an issue. So we want to move that frame to illustrate the landscape. What surrounds us shapes us. We need to show that landscape as opposed to the portrait that we're also used to seeing. We want to make sure that we articulate values, especially if we want to get to a health equity frame. A major way of doing that is to illustrate our values. Why is it important to make a change? What's at stake? And I'll give you an example of how we include values in our messaging. And then, of course, assign responsibility for a solution. So again, message strategy is about what we want to say, what the message is, who says it, who the messenger is, and the target, who we want to hear our message. So if you don't remember anything from this quick deep dive into strategic communications, I want you to remember these three components of a message. This can be your basis for your elevator speech to a grant proposal. What are the three components of a message? What's wrong? Why does it matter? What should be done? If you can break your message into those three components, then you have really the basis for talking points for all types of messages. So again, your statement of concern, your value dimension, and your policy objective. And I'm going to give you a quick example. There we go. So here's an example of that formula. So I state the problem, and this is just something that I made up, so it's not necessarily, it's not an actual problem, why does it matter solution, but I wanted to illustrate this rubric for you. Over 5,000 Oakville children and adults are at risk from diabetes, heart disease, and other illnesses due to the lack of healthy food options in their neighborhoods. Let's include some values. It's not fair that so many of our families can't shop for affordable, healthy food and beverage options in their neighborhoods due to the lack of grocery stores. All residents of our community deserve to live healthy and fulfilling lives. As you can see, I included several values there: fairness, affordability, neighborhood cohesion, deserving to live a healthy and fulfilling life. All of those are cues to reach our audience's hearts as well as their minds. And then last, what should be done? So here's just whatever your solution is. City Council of Oakville should approve Proposition B to increase the number of healthy options at 25 targeted small corner stores by January 1st, 2008. Important to keep in mind that not only is the message important, but your messengers. Here's a list of a variety of messengers and what we call authentic voices who can speak about an issue from a different point of view, as long as they're all pointing in the same direction, which is what is your policy goal. Some quick message delivery tips. Use the components of a message, as I said earlier, for your talking points. Stay on your message. Resist the urge to say everything. Remember, you can't be strategic and comprehensive at the same time. Stick to your expertise. Prepare for hard questions. They're inevitable, and you want to be prepared for them, and you can guess about what 90% of those questions will be. So from a strategic standpoint, it's a very good idea to prepare for that pushback that you might get. Provide compelling examples. Avoid jargon, and this is a big one for public health professionals. We speak insider speak, and we really need to practice making ourselves accessible as possible. And then, of course, follow up. So I'm 4 minutes over my my little deep dive, but I had a lot of information to cover, and I understand that the questions will save some questions for the end.
Absolutely. Thank you so much, Fernando. You covered a lot of space and help us dive in there with you, and I know folks are going to want to pose some questions out or kind of dig into some of those elements. I know I do as well. But I just wanted to thank you for covering a lot of ground in a limited amount of time. We'll come back to a lot of the kind of overarching, really sort of strategies and tips that you shared with all of us. So, you know, I just wanted to take a moment here to reflect on, you know, not only what Fernando via BMSG just shared, but really some of the important efforts that have been showcased and talked about via previous examples and experts on our Planners4Health webinar series. It's very clear that all of you, and understanding that many of you have been part of Plan4Health, Planners4Health, or really are just committed to this intersection of planning and public health, that in fact there is so much momentum has been built and there's so much traction for all of this approach in particular. So, you know, continuing to set up this path for success for the intersection of planning and public health, you know, is happening. And so this movement continues, and I think what we can really sort of see elevated from everyone who has spoken on this webinar series so far, and what Laura will speak to as well, is just that, you know, a lot of this work is focused on innovative actions from different regions across the country. And so, you know, what is innovative in an urban community or rural or non-coastal is going to be different, but nonetheless, it's innovative and it's very specific in many cases to the community in which, you know, those efforts are focused on. So the idea that collaboration and community ownership and community values are really what helps to drive that innovation and that traction locally is key, no matter sort of where you are or what specific policy or system change you're thinking about. The other piece that stood out, you know, in our conversations is how improving these systems, these environments, you know, for youth and future generations, but also for existing populations, for older adults or people with disabilities, or, you know, those who really want to be able to be healthy in their communities. And that spans ages, abilities, genders, races, so many different things. So how do you really tap into that? And the other thing that really sort of strikes us is that these are tangible, but very much so yet catalytic efforts that are happening in communities. And so I think tapping into, you know, these points along with the strategy that Fernando mentioned is really going to help, you know, everyone sort of reap the benefits of the work thus far under Plan4Health and Planners4Health as well.
One of the things that Fernando spoke to so eloquently was the importance of communicating values in the way you talk about your work and in setting the agenda for this healthy planning movement. And I think one thing we can each take away back to our own teams and in our own work is thinking about what are the local values of our community. Each of us knows our community best. So when you think about what are the messages and what are the approaches that are going to really resonate, it's important to lead with stories that are compelling, you know, using data, using personal stories, setting the frame, as Fernando described, but in a way that's really rooted in values that you know people already care about. And that takes understanding the identity and the culture and the traditions of your community. So, for example, maybe your community is one that has a long history of innovation and industry. Maybe it's one where community mobilization is something that has been really strong over time, or a strong local culture of giving back and of service, or being a gateway for new Americans and immigrants, or educating future leaders, or preserving wildlands. You know, when you think about what is that unique identity, what makes people feel that strong sense of pride, that's a really important hook to tie your work into and to show this is how we are building on that value and creating opportunities for all of our community members to be healthy. So with that in mind, we have the opportunity to learn about how the Plan4Health Coalition is doing just that in the city of Columbus, Indiana, great state of Indiana, not Ohio, I will mention, and how they've really been translating some of these concepts into action on the ground and with a diverse array of partners and community members. So I'm delighted to introduce Laura Garrett, who's the Community Initiatives Lead for Columbus Regional Health's Healthy Communities Initiative. The initiative is a broad-based collaborative that has the goal of improving the health and quality of life of all residents in Bartholomew County, Indiana. Laura works collaboratively with the local government, businesses, nonprofits, schools, and residents to encourage the community to build environments, policies, and programs that support a healthier, happier, and more physically active population. Laura earned her Bachelor of Landscape Architecture degree from Clemson University and dual master's degrees in Public Affairs and Environmental Science from Indiana University. In her previous roles, Laura has worked to develop parks, trails, and active transportation projects all across Columbus. And among other accolades, she helped to get the City of Columbus recognized as a bronze-level bicycle-friendly community from the League of American Bicyclists. Before we started our call, Elizabeth told us that Laura is a bona fide planning and health celebrity, so we are thrilled to have her with us today. And Laura, please take it away.
Well, thank you for that glorious introduction, and I would say that celebrity may be going a little over and beyond for sure, actually. And the story I'll tell today will just tell, all the ways we've really messed up here in Columbus in hopes that everybody can learn from us. So I appreciate being on, and I'll do my best to speak about what planning and public health look like in Columbus, Indiana, and our method for communication. I've been working in the public health, walkable, bikeable community world in Columbus since 2004. And you could say, based on Fernando's presentation, that I am a messenger. That's really one of my biggest roles. As the introduction stated, I work for Healthy Communities. We're actually funded by our hospital, and our initiatives are data-driven, and one of those initiatives is the built environment. We were a Plan4Health recipient in 2015. So the best way for us to explain our communications strategy is to tell one of our many stories, one that represents the changes that have happened in our community and our strategy to encourage community design that supports active living. One that ultimately captures and reframed our approach to the built environment work, as Fernando greatly spoke about earlier, related to reframing. Our story begins in 2007, so 10 years ago. The location is Columbus, and yes, not Ohio, on Weston Edge Drive, which is circled on the map. Columbus is located approximately 1 hour south of Indianapolis and has a population of nearly 46,000 within the city limits. So we're a medium to small-sized Midwestern community. Weston Edge Drive is approximately 1 mile in length. This is a current photo to give you the feel for the street and the street character. The corridor is a critical north-south connection in our community for bike and ped travel. There are only 2 other direct routes, north and south, in proximity to Weston Edge that go across US 31, a major highway running east and west. Both of these alternative routes have multiple lanes and higher traffic, which is not ideal for pedestrians or bikes. It's a critical corridor because of the proximity to the parks, on the green on the map, our downtown, the blue circle, and our schools shown as yellow dots. The street truly is the key north-south connection in our community and was not doing well safely accommodating the existing users. And our goal in turn is not to just accommodate those that use the corridor, but in hopes to increase the number of people that are walking and biking through the area. So, in 2007, we decided the street needed a redesign. And like many public meetings, we presented to citizens what we felt was a plan to turn Weston Edge into a complete street. We presented not so lovely drawings, as shown on the slide, and told the citizens how wonderful bike lanes and sidewalks would be on this corridor. We thought everyone would be thrilled, but we were wrong. Tom and Mary launched a why campaign in the neighborhood. 60+ people arrived at the public meeting wearing why shirts and arguing about every element of the plan. They even lined the right-of-way with caution tape to show how much would be lost. To fully understand what was happening in Columbus during the time, and understanding that we've actually gathered afterwards that helped us frame the reasoning why this has happened, I must show you the most recent street improvement project, Rocky Ford Road. This was a 2-lane street that was improved into a giant landing strip for airplanes, just the way we do it out west in the Midwest. Well, not really airplanes, but it's an attempt to be a complete street. The improvement has currently taken the life of 2 pedestrians to date, 1 child attempting to cross the street to visit a friend, and 1 elderly lady attempting to cross the street to the bus stop. What some felt was an improvement because the street gained sidewalks was definitely not a good thing, and Tom and Mary did not want this to happen in their front yard. To give a little current-to-date update and a huge win on our part, we're actually road dieting this street this summer, so slowly we're making some progress. So they successfully fought the project. They fought it because they loved their neighborhood and didn't want to lose the character of the place they call home. Let's pause a minute and reinforce the successful elements of their communication campaign. They went door to door, having personal conversations with each family member to educate and engage the surrounding community. They utilized speed guns to capture the high speeds of people traveling the corridor and used this data to build their case. They educated the public through letters and articles in the local newspaper and a very obvious display with bright yellow caution tape. They developed a unified voice, why, and gave those without a voice a green shirt, which filled the public meeting with a sea of green. And they were successful. The city pulled the plug on the project. The political nightmare caused by the neighborhood stopped the project and stopped it from even entering conversation again until 2016, nearly 10 years later. And just imagine, they did all this without social media of any kind. Many of us were sitting back, upset and confused that they were fighting progress and they were fighting safe bike and pedestrian travel for the many students and community members that use the corridor. What we didn't know at the time, because of many variables at play, was that we both wanted the exact same thing. We were arguing about the exact same thing, but engineering design in 2007 in our community hadn't caught up with the needs of the residents. We were building roads wider and just adding bike lanes and sidewalks. We weren't designing the roads for the particular areas they travel through. We also failed in communication. The community did not understand the value of a complete street, and we did a poor job explaining it. What appeared to be the end actually became the beginning for us. Though the project was stopped in the public eye, we knew we had to keep moving because this work is important. If we didn't begin designing better streets, we couldn't expect the benefits of a healthier community. As we evaluated how we were going to keep moving forward despite the public and political unrest, we formed a Bike and Ped Plan Committee and a Safe Routes to School Task Force, both made up of key individuals in the community. These teams assess the landscape through public surveys, bike and ped counts, site visits, and all this data was then used to improve our policies. We created a bike and ped plan, a complete streets policy, and a safe routes to school comp plan, all of which were successfully adopted in 2010 and 2011. And in conjunction with this policy work, we spent the next 9 years educating and building a support network. We needed to find people that believed in healthy streets and would help encourage others to show support for future projects like West and Edge. We were the recipient of a $2 million CPPW, Communities Putting Prevention to Work grant in 2010, which allowed us to start compiling a list of advocates and begin coordinating programs and events to get people moving. We celebrate biking in May and walking in October, as you can see on the calendars. The key to these months is that we don't necessarily program each and every event. We partner with a lot of community organizations and have them coordinate the events. This allows us to increase our list of partners as well as broaden our community reach. All of the events are aimed at bringing the community together, getting the community moving, educating the community, and encouraging the community to speak up for healthy street design. Plan4Health allows us to further develop our goal to the healthier street and develop our Go Healthy Columbus brand, which includes a website, blog, and newsletter. Go Healthy started as an idea from our MPO. It was one component of a marketing campaign targeting transportation. Go safe, go healthy, go equitable, and go grow Columbus. The entire campaign wasn't realized, so we hijacked the Go Healthy section. What appeared to be the actual end became the Having worked to engage the community for years, prior to the brand development, we had an idea of what features we needed in the community. We wanted to ensure the campaign was engaging, community-oriented, multi-generational, and simple. Our goal was not to create a website and brand that would become an engaging resource. There was no single place in our community to find information on biking and walking, and also education about how streets play a critical role in your community. As you can see, there is a resources section that has information community members would need, including architectural bike tours, which leads me to the next bullet, community-oriented. We regularly hear the statement Columbus isn't Portland or California, and therefore put a huge focus on creating a community-specific identity. Columbus is known around the world for its collection of work by renowned architects, landscape architects, and artists. We're actually ranked 6th in the U.S. for architectural innovation and design, noted by the American Institute of Architects. We even have custom C-bike racks, which were regularly mistaken for public art when they were first installed. Therefore, we were very deliberate about the unique design of Go Healthy and our wording to include community design that promotes healthy, active living. We wanted to make sure we had a community-specific resource that educates on opportunities that exist and celebrates those achievements we make along the way. When you analyze census data, often communities have a majority of a particular age group. Well, not us. We recently discovered that we're an even split, 13%, 13%, 13%, or something along the likes. This makes it really difficult, but also very interesting work. Whether it's safe routes to schools, the carless millennials, or the ability to age in place, we have to ensure we cover it all. We often customize the conversation based on the audience. However, for the website, blog, and newsletter, we do our best to include a bit of everything. Finally, our goal was simplicity. We wanted something that was easy to read and also easy to edit and update. The goal of Go Healthy are simple, creating a community that encourages all to bike and walk. The work is the hard part, especially when there are way too many streets that look like this in our community. Healthy Communities plays a critical role in the work by bringing experts in to educate our community leadership. We don't have a lot of on-the-ground examples of complete streets, so we hired the Walkable and Livable Communities Institute to develop a photo vision for 25th Street, one of our main city-owned roadways through our community. We hoped that this would portray many of the tools that are used to calm traffic and build better streets. Though this was met with some resistance, our goal was to show everyone the transformation possible when a street is treated as a properly designed public space. This brings us back to our story. 9 years later, a breakthrough happened for Weston Edge when the Walk Institute was in town. Healthy Communities pulled together a Safe Routes to School discussion and invited the residents to join in. The city wasn't at the table for this discussion because we wanted them to attend in a non-threatening way. We weren't talking about Weston Edge. We were talking about making streets safer for kids. I couldn't sleep for about a week worrying about the outcome of this meeting. Would they show up in their Y shirts again? The opposite actually happened, and we all had a conversation, and this conversation helped us truly understand that our goals were all the same. This led us to approach the city engineer and encourage opening up the Weston Edge project for discussion again. Healthy Communities funded Mark Fenton to facilitate the workshop, and this ended up proving to be a huge success. Having an outside voice help educate and facilitate was crucial because on the evening of the public meeting, people with pitchforks in hand came out, fighting change, protecting their neighborhood. Only this time, 9 years later, we took a different approach. Rather than showing the community a design, we asked the residents to design their street. What do you like about Weston Edge? What don't you like? While they answered these questions, we educated them on various street design characteristics that can help alleviate the problems they were mentioning. And instead of only showing engineered line drawings, we partnered with Pete Fritz from the Indiana State Department of Health to show visuals of how these various techniques would look on the corridor. Techniques such as traffic circles, street trees, wider sidewalks, and narrower lanes. Many of things some communities are getting more used to, but we don't have a lot of. Techniques critical to complete streets. The response was tremendous. Despite disagreements, there was a healthy conversation and a unified consensus that the street needed improved. While one neighbor yelled about not wanting sidewalks in her front yard, another told a touching story about the importance for the kids that do live or will live on the street. One woman silenced the room by talking about her neighbor's child that she helps cross the street each morning because their mother is sick and dying. She spoke about how much safer it would be if they had had the ability to walk on a sidewalk up to the crossing guard. In a wonderful way, she refocused the me-centric crowd into a crowd that was thinking about community need over their own. Weston Edge is back on the list for redesign. However, this time the design will truly be a healthy street the community was part of creating, and a healthy street which the residents are proud to live. Based on our experience with this particular project and others, I would encourage you to do the following. Use policy work to educate your community. The policies are critical to progress. This is also a great opportunity to bring in an expert voice. Professional facilitators have the ability to guide the conversation and are often heard in a different way than actual community members. We truly feel that the Walk Institute and Mark Fenton were the tipping point for this project. If we had facilitated this discussion locally, we may not have been successful. Don't be afraid to talk to people. Tom and Mary weren't afraid. Often we develop entire media campaigns without ever asking people what they think. A one-on-one conversation can take you a long way. Our city engineer recently told me about how the Weston Edge project has reshaped his philosophy about going to the public. He said he used to feel like he had to take a preliminary design to them to get a reaction. Now he has started hosting neighborhood meetings at the beginning of a new project. In doing this, he has found that neighbors have some great ideas, and in turn, the connection, support, and buy-in throughout the project ends up creating more successful projects in the end. Make your campaign community specific. What makes your community unique and great? Tie your work to that. Also, gain a better understanding of the community you are working with by looking at census data and local surveys. This will help you determine the most effective angle to take with your limited dollars. Keep it simple and visual. The general population doesn't care about the details and has a really hard time understanding all the elements of various plans and the work we do. They want to know how something impacts them, and it needs to be shown in a simple way. And finally, have fun. It's easy to get bogged down in the details and depressed about how slow the process can be. For Pete's sake, this one project has been on my mind for over 10 years. Plan an event, organize a celebration, walk or bike to school with some kids. These moments make the fight worth it and re-energize you to keep going. Though I didn't have time to cover everything, I hope this presentation gives you an understanding of the true impact good and bad communication and messaging have had on our community and our work over the years. As we did, we wish you many opportunities to fail forward. And I look forward to the question and answer session at the end. Thanks for listening.
Laura, thank you so much for a number of things, including, I think, so many of those important points that you just recapped, but by really modeling, I think, a lot of what we've been discussing so far on this webinar and in other conversations. You really made it a story, and I think we were all following the various characters and players and celebrating kind of right at the end with you. So thank you for that. And we are taking questions and comments and reactions, so please feel free to send those via the chat feature. We're collecting those, and we're going to pose those back out to our experts and our panelists here. So I know there's a lot of thoughts on folks' brain here, and so maybe we should have a bit of a brainstorm on that as we start to kind of corral some of these questions. But, you know, maybe I will ask this question of both Fernando and Laura, which is, you know, given the work and the strategy that you all shared, what do you think is sort of next for you, sort of in your personal professional sphere, and what are you sort of most excited about in this area around, you know, planning public health and really the sort of strategic communication that you're all doing?
I'm sorry. Could you repeat the first part of that question? It was a little muddled, and I'm afraid I didn't quite get it all.
What's next for you? What are you most excited to be working on? You know, given what the work that BMSG is doing, is there an issue area or something that's really kind of, you know, you're excited to be delving into in this, you know, health arena?
Sure. Well, we deal with a number of issues. As some of you might know, our organization really does research on all kinds of public health issues, some of them more controversial than others, but currently we're looking at childhood trauma and having institutions and schools and other organizations more trauma-informed. We're working on abortion stigma and what some of the messages, or rather what some of the dominant themes that we've seen in the news media. We're looking at community violence, youth violence. So we really concentrate on a number of issues. But I think what's most exciting and challenging for us is to continue to dive into issues that you all are very interested and concerned about, which is health equity, and talking about equity in a way that's going to move people from individual responsibility to collective good, that's going to be able to have productive discussions around race and ethnicity and privilege, about, given the current political landscape, what are some of the communications challenges that we'll be faced with. So really there's just so many things that we have our hands in, but I think really this issue of how to better talk about equity and really move the dial and change the conversation is really what we're looking forward to.
Fernando, I wanted to mention one thing before, Laura, we ask you the same question, and that is here at Prevention Institute, we've also been doing a lot of work around trauma, building on a lot of the momentum and the research in the field about adverse childhood experiences, or ACEs, to get back into our jargon mode.
Right.
And also looking at the context in which adverse childhood experiences happen beyond just an individual or a family, really looking at the community context, understanding that trauma can occur on a community level and that there are also community level approaches to build resilience in the face of trauma, essentially moving trauma-informed strategies out of really a clinical care model and more into a community prevention model. But I mention this because one thing that has really stayed with me throughout doing this work and learning more about the work is a fundamental question that we have asked, and it speaks, I think, Fernando, to the frame that you mentioned, which is rather than asking what is wrong with this person or what is wrong with this community, to ask what happened to this person, what happened to our community, and that cueing the conversation in that way, it opens the door to different approaches and to a different way of looking at the issue. So I share that just because it's my mind, but I think it's particularly interesting.
Absolutely, I totally agree. And you know, one of the things that I also do for BMSG is I write blogs, and right now I'm working on case studies. And one of the case studies I'm working on is looking at Richmond, California's formerly incarcerated re-entry efforts, and they talk about how, you know, this is really about changing the narrative, changing people's minds about this misunderstood population, and it's really about storytelling and talking about how community trauma plays a role in a quarter, you know, in what has resulted in 25% of the nation's largest state having a criminal record of some type, whether it's formal incarceration or just having, you know, some type of criminal record. You know, that of course is part of historical and social forces, including the war on drugs of the 80s and 90s, and you know, we can get into more of that context, but I think getting to your point about understanding and really moving to more trauma-informed institutions so that we can be more upstream in addressing really the consequences of community trauma.
Thank you, Fernando.
A lot to explore there, so thank you for putting that out there.
Laura, we would love to hear what is next for you, what you're excited about in your own work or in the field. And then we've got a number of questions coming in from participants, so we're going to start diving into those. And the first one will go to you, Laura. So 2 in a row for you.
Excellent. So excitingly, we've been through a lot of changes politically and in our community, changes of mayor, changes of engineers, and currently our city officials are in a really good place to start getting a lot of bike and ped work done, and we've budgeted to update the bike and ped plan that was created in 2010. And then, as I mentioned in the presentation, we have a road diet coming and a bunch of trail infrastructure this summer. We really have an engineer in place right now that's going to try to crank out as much as he possibly can while everything's favorable. So we have a lot to look forward to currently. As far as the built environment work, as Healthy Communities goes, we've launched a whole mental health and substance abuse action team and are really trying to conquer the opioid and meth epidemic in our community on a local scale here as well. So it's a breadth of exciting work.
Absolutely. Very important work as well.
Laura, I'm curious, one of the questions that came in was about how much the business community participates in the Healthy Communities Initiative and in the Complete Streets work. The participant said, my experience is that the business community usually does not come out and take positions on public projects like sidewalks. What has your experience been?
We have that very same experience. They have a hard taking an exact stand. We have our chamber is supportive, and they were actually helped fund and organize when we brought the Walk Institute into town. So they're very very supportive on the large scale, setting the notion of we need to build a better community to walk and bike. But when you get down to the nitty-gritty table and you're standing up in front of the Plan Commission fighting a project, they're not the ones that are going to be at your side. But they often, if the right people are there, we have them kind of feed us information that would be useful for that particular reason. But yeah, we don't get very strong business stance on many of the projects. I wish we did. We get really strong our bike shops. And Cummins Engine Company, I didn't mention this, which is a large diesel engine manufacturer, has great support financially for different projects in town related to the environmental benefits, and they would like to see their employees biking between facilities, and so they were one of the major funders along with the hospital for our bike share program that was installed last year. So I guess on one set in the Plan Commission meetings or just fighting for a particular project, that they might not be at the table, but some of our really large employers are when you really need them. Does that answer the question?
Yeah, and I think you mentioned, early on you mentioned about, kind of the hospital's role, and we can see the hospital as a, provider of services and a hub for health, but they're also, it sounds like, a major employer. And so I think for the business community, in our experience, we've learned that really speaking to, that need to be able to recruit and retain, healthy employees that have access to those opportunities and options is a good strategy to kind of engage folks there. So thank you for that.
Yeah.
Also, folks have talked about and mentioned you gave us this amazing story, and you really kind of pointed out, as you said, sort of the successes and the failures over a set of 10 years, which I think for a lot of folks is comforting. It's good to acknowledge that it's a long-term process. Could you speak to sort of what your community engagement activities in that 10-year process, how did you think about that in terms of like sequencing, bringing community members in and community stakeholders in to even identify the values for the community in this project, and how did you kind of connect that with your own communication strategy and your implementation of a plan?
Yeah, I can definitely. So our first strategy, as we're standing there in shock, not knowing, all that's at play. When you look back on it, it all makes sense. But when we were in it, it didn't make sense at all, except for how once we figured out what the missing components and what that frame that broke down was, we realized we needed to get advocates. We really needed to figure out how to find those people that are biking and walking and give them that connection and collaboration. So a lot was done just hosting events, or we had commuter challenges, or we had walking events, or we started doing free valet bike parking at our farmers market. And every touch point, we took down names and email addresses and connections and built it one by one to the point that we felt like we had a core group of people. And then during doing different surveys and doing different data gathering, kind of we're able to decipher what that voice was. But out of it all has spun just, getting more people together sparks even more interest. So we have different things like our Columbus, Indiana Wednesday night ride group, which rides every Wednesday, has 60 to 80 riders every single week going out, and it's become one of our big advocacy bike groups in town. So we didn't have any of that. So our step one was to build that core of support. And then step two was to take that core of support and create the marketing message to take to the general public. So doing things like our photo vision, or something that reaches beyond those people that are already riding or that are already walking or that are already healthy. We want to tap into that next level. And I would say we're just on the brink of that. And I think that's going to be a continual, forever process, is figuring out how to get those people that aren't healthy to make that next step. And I think that's what we all struggle with out there. But so step one was to get the people, and step two was to develop the message that resonated with a lot of people in our community. And then step two is to take it, and we've had some other contentious projects with a state road project coming through, and they really need to road diet, and there were points where I was using the listserv just to give people the opportunities to engage, like, come out, we need you here, we need you to speak up, because if I'm the only one up there, they only listen for so long. We had to find those people that were willing to step up and support the projects as well.
Thank you, Laura. It does, yeah. That was very helpful.
And I think I saw, really quickly, I think I saw someone put about the time frame, that this was over 10 years, but really how much time was the communication and marketing. Really, the Go Healthy launched with the Plan4Health work, and that Plan4Health grant was a one-year initiative. So we really developed that brand, created the listserv, the blog, the website, all the resources within a year time frame. Though we had a lot of back knowledge, you know, the actual implementation took 6 months to a year.
Thank you, Laura. Fernando, a question came in about how to encourage one's own organization to shift more towards the media advocacy approach. I think you mentioned the public health field in general, I think, is more comfortable and more rooted in social marketing approaches. So the participant asked, I'm not sure how to make the case to my supervisor. And I think that's such an important part of communications, is about communicating internally and then communicating externally. Could you speak to that, please?
Absolutely. So one of the roles that public health, people in public health can have to sort of introduce their organization or their department to media advocacy is to serve as what we call authentic voices. So they don't necessarily need to advocate for a particular policy, you know, or attend meetings for, you know, some soda tax campaign or complete streets or what, you know, bike to work to school lanes. That's work that is more involved and really includes the mobilization, the grassroots organizing, and other types of activities that people in public health either may be a bit uncomfortable with or not quite sure how to navigate, or just haven't had a lot of experience sort of on the ground that way. But an important role that people in public health can play, and this is one thing that can be discussed internally with organizations, is how public health professionals can serve as messengers or authentic voices by providing data, trending information, studies that might be done, or localizing perhaps studies that have been done on a perhaps county or statewide basis, but providing that sort of unbiased information and data that supports the more personal, maybe values-based statements or arguments that community members can make and are more comfortable making, and frankly are in a better position to make those value statements. So being a part of a solution to a health problem can involve just providing information that can support the work of advocates on the ground. So that's a way to sort of dip your toe in the water, so to speak, of media advocacy.
Can I interject? That's a great point that you make, and one of the largest roles Healthy Communities plays in this work is through our community health needs assessment. We gather the data from the community, but even down to the point, I can't tell you how many meetings I'm in where I say, well, let's just go out and do a count really quick and see who's out there. And then I get all the volunteers out there, organize the hours, have them go stand at the intersections and gather that data of how many people are walking and biking in through, or how they're using a corridor, or what the tobacco or what our marketing in the local gas stations are. So I'm glad you made that point, and it's so crucial to the work as far as the public health side.
Thanks, Laura.
Fernanda, we had another question come in about providing another example of a frame and how we can shift the frames that people may hold right now. How much do we accept them? How do we go about shifting them? Whether there are any other examples you can use.
Sure. So the shifting of the frame really involves just sort of going back to how you do it, and then I can think of some examples. But again, it's about understanding and recognizing sort of default frames that the majority of people will hold around a particular issue. I used rather than, again, saying obesity, I talked about diabetes and other nutrition-related diseases. That is an issue that is typical of that dominant frame of individual responsibility and versus the environment, especially this particular issue, because it really brings to mind character flaws or moral failures, and we still see a lot of what people call body shaming going on in the media, and so it's still a very dominant sort of point of view about what we do to our bodies is really in our complete control. And so that frame, fortunately, we've seen so much momentum going on in the food and nutrition policy area that we're starting to see institutional not accountability, but the institutional role of this problem. And we're starting to, like tobacco, we're starting to focus on the industry's role, the food and beverage industry's role in our problem with nutrition-related diseases. And then we can take that a step further and look at how conducive our neighborhoods are to providing physical activity. And so, like Laura was talking about how engaging the community was part of expanding that frame to include the environment, was such a smart and successful sort of approach, because it was that reframing that that sort of allowed the community to do that themselves by looking at the data, by being involved in compiling the data, by being involved in using their own language to talk about what a quote-unquote complete street would look like and what they wanted that to be like. So there was such really a coordinated, sort of successful effort to reframe there that it really followed that idea formula of moving from the portrait to the landscape. And so, other issues, we can really talk about that in so many ways and with so many issues. I was just doing a training in Stockton, California, which has the dubious distinction of having some of the highest crime rates in the state for a community its size. And so they're really fighting a dominant frame of, these are bad communities that, any type of economic or other type of investment is going to be a waste of money because they're intrinsically bad neighborhoods with bad people who do bad things. And so reframing the conversation is really about talking about not just how they're addressing crime, but also being more aspirational and talking about how recent community efforts to invest in the community has resulted in, more students graduating from the school. There was a person who talked about how the nightly news, when they're talking about a crime that happened in Stockton, they used that same crime map. And somebody came up with the idea of providing the local media with what they called an opportunity map, which shows where successful businessmen, faith leaders, athletes, and others have come out of this same neighborhood that has been framed as such a negative place to talk about how investment can change the narrative literally, and showcasing those affirming stories. But of course being cautious not to sort of look at them as, well, here's an individual who fought against the odds, and so anybody should be able to do it, and that's still a bad neighborhood. Two, here's an individual who changed the odds, and therefore we can see other stories of success and hope coming out.
Fernando, we'd like you to come to Stockton, to Oakland, to Columbus, Indiana, to Rhode Island, to so many places, because this is exactly the conversation and the encouragement and the strategy that we need in so many different communities. So while we hold that invitation for you always, and Laura as well, we should just do a tour with you all sort of starring in it. I just want to acknowledge that all of what you're mentioning and kind of speaking to today, comes from a very rich, professional experience, and that a lot of your organizations, your initiatives have so many resources that can go very deeply into this around framing, around strategy, around this, collaboration that Laura spoke to in community engagement. So I just want to encourage everyone to connect, with your organizations and your institutions to learn more about that. And as we sort of wrap up this conversation, just want to pose a last question to each of you, which is, in addition to your resources, and you can definitely name drop some of those, are there any resources, tools, examples, news stories that you sort of think about as good examples or really interesting to maybe the folks on the line who are really trying to explore and figure out where they start on some of this communication strategy?
Well, I'll go first, and what I'm gonna do is plug our website, because we do have a lot of resources that you can look through for case studies, for messaging guides, and other resources that are available. Two that I'll point to off the bat are the layers of strategy, which I mentioned earlier, and I believe we had a question about explaining that a little bit more. So you can explore our website, download our layers of strategy, and get a lot more information about that as the sort of cornerstone of media advocacy. I would also strongly encourage folks to read What Surrounds Us Shapes Us, which is sort of a good primer on media advocacy, especially around having conversations around health equity. And so I strongly encourage folks to read that paper that is easily downloaded from our website. We also have a search function where you can just do a little poking around.
Thank you, Fernando. And Laura?
Well, a lot of what I mentioned and things like our calendar and our maps and all that is on our Go Healthy Columbus. So it's gohealthycolumbus.org in the resources section. So if anyone has any questions on, some of those resources, or I went through like the bike map or the bike month stuff really quickly. So if you're just curious, I saw some questions related to engagement activities. Those calendars are really good at kind of showing some of the engagement activities we do throughout the year. As far as other resources, I find people to be my best resource. Kim Irwin and Health by Design in Indianapolis has been instrumental, along with people like Mark Benton and Robert Ping and some of the other experts in the community that kind of help point me in the right direction and keep me moving when I find myself beaten into a 6-foot hole. So I guess my advice would be surround yourself around those people that help lift you up and keep you going.
Thank you, Laura. In our next session next month, we're going to be talking about how to sustain that energy, how to sustain momentum, how to sustain coalitions and networks to plan for health all across the country. So with that, I'm going to thank Fernando and Laura so very much for your time and for sharing your expertise. I want to thank all of the participants for joining us today. And Elizabeth, we'll hand it back to you.
Wonderful. Thank you so much, Rachel and Sandra, for facilitating that this afternoon. Please look for a recorded copy of this webinar in your inbox, and I will add links to the 2 resources that Fernando and Laura just mentioned this afternoon. So thank you so much. That concludes our session today, and we hope to see you back in July.